Burnout is a significant challenge for mental health professionals, impacting both personal well-being and client care. This episode serves as a companion to Therapy Training's 2023 Avoiding Burnout training course. We'll discuss the signs and symptoms of burnout, explore strategies for prevention and management, and provide insights into maintaining a healthy work-life balance. Whether you're feeling overwhelmed or looking to support colleagues, this episode offers practical advice to help navigate the pressures of the mental health field effectively. By the end of this episode, you'll gain a comprehensive understanding of burnout, including its causes, signs, and the profound impact it can have on mental health professionals. We'll explore effective self-care strategies, boundary setting, and ways to cultivate social support. So whether you're a seasoned therapist or just starting your journey in mental health, there's something valuable here for you. Let's start with a basic definition. What exactly is burnout? Burnout is more than just feeling tired after a long day. It's a state of emotional, physical, and mental exhaustion caused by prolonged and excessive stress. It can manifest in several ways: diminished interest in work, feelings of cynicism, and a sense of reduced personal accomplishment. And believe it or not, it's not just an individual issue. It can ripple throughout the entire organization, affecting team dynamics, client care, and overall workplace morale. So, what are some of the common causes of burnout? In the course, we learn that burnout can stem from various factors, both personal and professional. High workloads, lack of control over your work, insufficient rewards, and poor workplace relationships are just a few of the culprits. As mental health professionals, we often take on the emotional burdens of our clients, which can compound our stress levels. And let's not forget about the societal pressures we face, especially in these challenging times. But how do we know when we or someone else is experiencing burnout? Recognizing the signs is the first step towards addressing the issue. In the course, we discuss the physical, emotional, and behavioral symptoms. Physically, you might experience fatigue, headaches, or gastrointestinal issues. Emotionally, you might feel overwhelmed, detached, or frustrated. And behaviorally, changes might include increased absenteeism, decreased job performance, or withdrawal from colleagues. It's essential to stay attuned to these signs as they serve as vital indicators of our overall well-being. Now that we've identified what burnout is and its signs, let's delve into self-awareness and self-care strategies. Self-awareness is a powerful tool. It allows us to recognize our personal stressors, those unique triggers that push us towards burnout. What are some of your personal stressors? Is it a high caseload, challenging client interactions, or perhaps the lack of a supportive work environment? Once we identify these stressors, we can begin to implement effective self-care strategies. Self-care is not just a buzzword, it's an essential practice. In the course, we discuss various self-care strategies, including establishing a routine, engaging in physical activity, and ensuring we take time for relaxation and leisure. It's crucial to prioritize self-care as a non-negotiable part of our lives. A simple yet effective technique is to schedule breaks throughout your day, even if it's just for a few minutes. Step outside, breathe in the fresh air, and give yourself permission to recharge. Another aspect of self-care we cover is setting boundaries. This can be particularly challenging for mental health professionals, as we often feel the pressure to be available for our clients at all times. However, setting healthy boundaries is essential for maintaining our well-being. It's okay to say no, to limit your availability, and to create a structured work-life balance. Your needs matter too. Now, let's talk about some evidence-based stress reduction techniques highlighted in the course. Mindfulness is one such technique that has gained significant traction in recent years. Mindfulness involves paying attention to the present moment without judgment. It can be as simple as taking a few deep breaths, focusing on your surroundings, or practicing meditation. Studies have shown that mindfulness can effectively reduce stress and enhance resilience, making it a valuable tool for mental health professionals. Alongside mindfulness, relaxation exercises can also be beneficial. Techniques like progressive muscle relaxation or guided imagery can help you unwind and release tension. Physical activity, whether it's a brisk walk or a yoga session, is another excellent way to combat stress. When we move our bodies, we're not only enhancing our physical health, but also uplifting our mental state. Let's touch on a topic that often gets overlooked: the importance of social support and professional networks. As mental health professionals, we understand the value of connection, but how often do we prioritize our connections? In the course, we emphasize the importance of cultivating relationships with colleagues, peers, and mentors. These networks can provide emotional support, practical advice, and a sense of belonging. Don't underestimate the power of a simple phone call or coffee chat with a fellow professional. It can do wonders for your mental health. Now, I want to address a few common misconceptions about burnout that many mental health professionals might hold. One of the most prevalent myths is that burnout only happens to those who are weak or lack resilience. This couldn't be further from the truth. Burnout can affect anyone, regardless of their strength or coping abilities. It's essential to recognize that experiencing burnout does not equate to failure. It's a signal that something needs to change, and acknowledging that is a sign of strength. Another misconception is that self-care is selfish. In reality, self-care is an act of self-preservation. Just as we encourage our clients to prioritize their well-being, we must do the same for ourselves. Taking time to recharge enables us to be more present and effective in our work. Remember, you can't pour from an empty cup. So how do we integrate all of this knowledge into practice? The course encourages you to develop an individualized burnout prevention plan tailored to your specific needs and circumstances. Start by reflecting on what you've learned about your stressors, self-care practices, and support networks. Outline concrete steps you can take to mitigate burnout. This could involve scheduling regular check-ins with yourself, seeking supervision or consultation, or even prioritizing personal hobbies and interests outside of work. In conclusion, burnout is a significant concern for mental health professionals, but it doesn't have to be an inevitable part of our careers. By understanding its causes and signs, developing self-awareness, and implementing effective self-care strategies, we can cultivate resilience and maintain our well-being. Remember, you are not alone in this journey. Reach out to your networks, seek support, and prioritize your health. Thank you for tuning in to this companion episode for Therapy Training's 2023 Avoiding Burnout Training. I hope you found this information valuable and that it inspires you to take proactive steps in your professional and personal life. If you're interested in exploring more courses on mental health topics, be sure to visit therapytrainings.com. Together, let's work towards a healthier future for ourselves and those we serve. Until next time, take care of yourselves.